With the coronavirus crisis just 6 weeks after the first U.S. case was confirmed. Now there are more than 550 across 34 states.
The outbreak has now led the State Department to issue a rare warning urging every American against cruise ship travel. And it comes as the Grand Princess, which has been held offshore for days, gets ready to dock in Oakland, California. Its passengers now set to face a 14-day quarantine.
In the meantime, two members of Congress, Texas Senator Ted Cruz and Arizona Congressman Paul Gosar, announced they will self-quarantine. Both men recently learned they came in contact with a person at a conservative conference last month who then later tested positive for coronavirus. We've got angles covered. It's a lot to cover, actually, this morning. Let's go to NBC's Tom Costello leading us off. Tom, good morning.
Good morning, guys. We're in the Georgetown neighborhood of Washington, D.C., and behind me, Christ Church is closed because the rector has been diagnosed with the virus. He says he and his family will self-quarantine now for 14 days. And while the risk for anybody outside and walking by is really minimal at best, people across the country are seeing anxiety levels rise over concern about what's being done to combat the virus. This morning, 3,500 people on the Grand Princess cruise ship will disembark in Oakland, California, after being ordered to remain at sea so coronavirus test kits could be delivered. Of the just 45 people tested, 21 have confirmed cases, 19 of them crew members. All guests will remain in isolation for 14 days. Meanwhile, in Florida, after being delayed from docking, another cruise ship came ashore Sunday night after workers who had transferred from the California cruise tested negative for the virus. It comes as the State Department issued a warning on Sunday that Americans, particularly travelers with underlying health conditions, should not travel by cruise ship, a point echoed by Dr. Anthony Fauci on Meet the Press.
If you're a person with an underlying condition, and you are particularly an elderly person with an underlying condition, you need to think twice about getting on a plane on a long trip. And not only think twice, just don't get on a cruise ship.
While here in the U.S., anxiety levels are rising from coast to coast, along with the number of cases. The list of states with confirmed cases is growing, now including Missouri, Vermont, Virginia, and Washington, D.C. Two members of Congress are now under self-quarantine after coming into contact with people who tested positive for the virus. Senator Ted Cruz of Texas and Congressman Paul Gosar of Arizona. Neither are experiencing symptoms. Cruz releasing a statement saying everyone should continue to treat this outbreak seriously and be driven by facts and medical science. The announcement comes as the Trump administration is facing criticism for sending mixed messages.
We don't have enough tests today to meet what we anticipate will be the demand going forward.
The president later contradicting the vice president.
Anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful.
Health Secretary Alex Azar forced to clarify the president's remarks, calling it shorthand, saying you may not get a test unless a doctor or a public health official prescribes a test. There's also confusion over how many people have actually been tested. The government has not released official numbers, but a watchdog group called the COVID-19 Tracking Project says just 3,200 Americans have been tested, compared with 188,000 in South Korea and 18,000 in the UK, where there are far fewer cases. While in Italy, drastic measures to stop the spread of coronavirus. The country has now placed more than 16 million people under lockdown, a quarter of the country's population, mostly in the north, where the spread of the virus has been rampant. We've also now got a growing list of cancellations and postponements. Among them, you probably have heard already, South by Southwest in Austin, that iconic festival, that's been canceled, a huge economic blow to the city. The BNP Paribas Tennis Open out west, that was going to include Serena Williams, that's been postponed. And listen to this one, NCAA says its Division III basketball tournament games at Johns Hopkins, they will be played, at least for now, without spectators. Guys, back to you.
A lot of people wondering about March Madness then, of course. Tom, thank you so much. Let's go to NBC News medical correspondent Dr. John Torres. Dr. Torres, so much to talk to you about this morning. First of all, the numbers, where we're at right now, about 500 cases in the U.S. People should be expecting to see those numbers go up and go up in a big way this week because now we're going to really start testing for it. Is that correct?
Exactly. I think you're going to see them skyrocket this week and next week because those tests are starting to get out. And people keep talking talking about 1 million tests. So if 1 million tests get out there and 1% of those are positive, that's 10,000 people. And so you're going to start seeing these numbers going up into the thousands. And I think people are going to get very concerned. Two things are happening. One is there are some new cases out there, but a lot of these are cases of people who were walking around and didn't even really know they had it. And now we're diagnosing them.
I mean, that's the point. It's here, right? You're not really saying, can we keep it away? They're trying to take those public health measures, but it's here.
It's here. They're trying to take those public health measures, which is an important thing to do because that social isolation, that distancing is important, especially for elderly and those with underlying health issues.
You do talk about the elderly. We're always talking about people over 65. Well, quite frankly, people in their 60s are the ones who are watching our show. A lot of us have moms or dads who are older, and we don't want to get it because we don't want to infect them. So the question is, what can people in their 60s, or what should they do other than not travel, which is what Dr. Fauci was talking about?
And the older you are, the more likely you are to suffer consequences if you do have this, if you do get coronavirus. And there's no age cutoff specifically, but we do know 80 and above is kind of one of the big cutoffs. 60 and above, too, can be a cutoff.
My mom stayed home from church yesterday.
Yeah,
was that the right thing to do?
It depends on who's in church and what people are doing. If they're coughing and sneezing a lot, then you want to get that distance from them, and it's really hard to tell. So if she has underlying health conditions, definitely do that. If not, then you have to kind of play it by ear and decide for yourself. It's your own personal risk assessment.
People have routines. Some people go to book clubs, they go to yoga class, and I think some people are wondering if that's.
And I think the reality is, for most of us, those routines are not going to be the same as they were a couple of weeks ago for at least the next few weeks.
Yeah. Real quickly, another issue that, frankly, if you start reading about it, can really scare you is this notion that our medical system is not equipped, even if if the virus is relatively mild or moderate in most people, and that is the good news, that the hospital beds aren't there, that the medical supply is not there.
And it's not just our medical system, it's medical systems around the world, but ours in particular, they're almost always at capacity because that's the way the systems are built. There are no hospitals sitting there that are just empty waiting for patients. And so they're almost always at capacity. If you get a surge like this, it's going to push them over that capacity. And that's when decisions are going to have to be made about what do we do, how do we handle the patients that might not need to be there, how do we handle these patients that might need extra rooms, do we build additional tents or facilities that we can put them in? Time will tell when we get this influx of patients what we need to do with that, and ventilators are going to be crucial.
Okay, all right, Dr. Torres, thanks for that.
Well, let's go now to the outbreak's impact on your money. The virus has caused losses to pile up on Wall Street, global markets too. Today could be another brutal one here. NBC senior business correspondent Stephanie Rule joins us with that part of the story. Stephanie, I did not have a good, warm, fuzzy feeling when I saw that the futures market, which is often a good indication of what's going to happen on Wall Street, they had that emergency trigger kick in to stop trading, to essentially stop it from going into free fall.
Correct. That mechanism was put in place for that very reason, because we saw last night markets around the world simply selling. And what this mechanism does is put a pause on things. Much of this is tied to Corona. What we are missing is global coordinated communication and leadership. Dr. Torres was talking just a moment ago. There's not necessarily enough tests, and people are fearful, and their lifestyles are going to change. That doesn't mean economic disaster. It means we need a recalibration. And one of the issues, and I promise I'm not here to criticize the president in any way, but one of the problems we're facing is from the day the president said, let's put Mike Pence in charge, and the 15 cases are about to go to zero, we know the opposite happened. And the numbers are getting higher and higher. So business leaders are canceling things across the board. People are staying home. What does that do? That stops people buying things and going out. It's certainly going to hurt cities where events were going to be held. We need to take action, but it doesn't mean that there's disaster underneath.
And on top of all of that, the numbers about crude oil, how the prices dropped 20%. I know that my fiance's in finance. He was literally ashen when he saw that. How worried should we be?
For the time being, worried. Last week, OPEC was meeting to discuss exactly this. The demand for oil in China because of coronavirus is way down. So how should they address it? Well, at the end of the meeting, Russia walked out and said, everybody figured out themselves. Saudi Arabia's response was, well, what are we going to do? We're going to jack up production and depress prices. Right. That sends oil producers around the world in a panic. Now, that doesn't happen for a few weeks. So this could get everyone back to the negotiating table to address these things. But at this moment, we need more coordination and more honesty.
All right.